And as our Keitha Nelson reports tonight in our Untold Truth series, Black women in particular are 3 times more likely to die from pregnancy-related complications.
You're likely wondering why. Well, there are several factors, including Black women are more likely to have chronic health conditions, less likely to receive adequate prenatal care, and some health professionals argue they're victims of a broken system.
She was special. Even if she wasn't your best friend, you still had a connection with her.
Number 36 on a line of 55 women connected through a sisterhood formed at Florida A&M University.
TJ is my line sister, sorority sister. We grow together, you experience life together.
And in this case, death far too soon.
We knew that she was pregnant, and then we knew that she delivered her baby, and then they said something is wrong.
In 2018, Tamara Johnson Thompson, at 34 years old, gave birth to a beautiful, healthy baby girl. But
They said Tamara didn't make it, that it was complications post giving birth.
In 2023, Black women had a mortality rate of slightly over 50 deaths for every 100,000 live births. That's more than 3 times the rate for white women and significantly higher than Hispanic and Asian women.
We've had a broken system for a long time, and we have not focused on maternity care in America.
Dr. Chandra Adams with Full Circle Women's Care fully understands what's contributing to deadly outcomes for Black women.
We're starting the pregnancy with high blood pressure. We're starting it with kidney disease or other factors that are risk factors for preeclampsia. We are developing these at higher rates.
Black women are 60% more likely to develop preeclampsia than white women. It's a serious pregnancy complication characterized by high blood pressure and organ damage. A critical maternal health disparity Carell Danzy was forced to face while pregnant with her daughter, talking to her doctor 2 years after losing her sorority sister.
You could have preeclampsia. He said that, and I didn't hear anything else. He said, I know my eyes started to water. I started to get scared because I knew that that could mean a death sentence for me and possibly for my child. What if Tamara's story isn't just Tamara's story, but it's all of our stories?
It's like, no, I just woke up.
Shanavia and Joelle Obimelekwe.
She says a lot of the things that she hears on there.
Welcomed us into their home 2 years after Little Ocean poured into their hearts love and fear like they had never known before.
Everything was fine until I went into spontaneous labor.
After being sent home, she says, by her doctor while 39 weeks pregnant with high blood pressure.
I just assumed that he would take it more seriously.
The Obimelekwe's describe their doctor as nonchalant and say they were treated poorly when given the option to go home.
We don't know what to expect. We've never done this before.
Shanavia's blood pressure dangerously high. After giving birth,
there was talk about, do I have advanced directives? Do I know who I would want to make the decisions if I do happen to have a stroke or worse?
I was devastated, confused, unsure. I put all my trust into the doctors.
JCAHO, the Joint Commission for Hospital Authority, has actually put in place certain metrics now because we have to address the fact that emergency rooms did not have mandates to not send women home if they've been pregnant in the last 14 days and you have a blood pressure that normally the ER would say, that's not a big deal. It's a big deal after pregnancy.
We're still traumatized by that.
What's going on now, Joelle?
We're pregnant. We have another one coming.
Yep. We do.
Yeah. Mm-hmm.
You guys think about your past experience when you think about...
100%.
Yes.
100%.
Danzy's baby girl Harper was born premature, but she's now a healthy, very active toddler. And while she and her husband contemplate expanding their family once more, still, in the back of her mind,
For me, I'm always trying to figure out why. Why did this happen to this person and not that person? Why? Why did this happen to her? Is this something that was preventable?
As the legislative session nears an end in Tallahassee, I spoke with Senator Tracy Davis. Her proposed bill dealing with maternal health and Medicaid did not make it across the finish line, but she is looking ahead to the next session, saying she'll revise the proposal and try again. And the Black Legislative Caucus aims to present a maternal health care package to include changes to Medicaid eligibility and doula services.
All right, Keitha Nelson with that reporting. Thank you, Keitha. And Northeast Florida Healthy Start Coalition has a lot of helpful programs in place. You can find a link to their website right now in this story in the First Coast News app.